in this debate that we're having is the absolute excitement and anger on the part of the grassroots in America.
Yeah.
And the Democratic Party can say all they want, that they control the grassroots, but there has been a bubbling up of people on the internet, on telephone, calling the office, writing letters. They're reading this bill. I would venture to say that more people in my district have read this bill than most members of the Blue Dogs.
Yeah.
Now, when he announced some of my credentials, it was not the True Blue Dog award. It was the True Blue award. Because I don't want to have any affiliation at this point with the Blue Dogs. I've been in, as he announced, I've been in public service since 1980. You can add it up and figure out how old I am. I've never seen a subject take over like this healthcare subject has. Cap and trade was people got angry about it. I don't think people understood all of the implications that cap and trade was going to have on their life and their pocketbook. Frankly, by the time Joe Barton and the Republicans on the Commerce Committee got to amending it, and it got through, it really took a lot of the teeth out of the bill. After the coal companies and the oil companies and everybody that the bill affected were basically given waivers, and they're not affected by the bill anymore. The bill is sitting over in the Senate. And while you're waiting, while you're talking about this bill to your senators, because the senators are key, tell them not only to vote no against the health care reform bill, but our deform bill, as we're starting to call it. Tell them to vote against that cap and trade bill. Tell them to vote against Spark Check. These are three things are the number 1, 2, and 3 issues that are before the Senate. They'll be before the Senate. That's where the action's going to be in September and October. Let Kay and John, let them know how you feel. Because I mean, they represent 24 million people now. Let them know how you feel. Don't assume anything with them. Let them know how you feel. I don't know how you want to do the questions, but I'd say let's go a lady, then a man, then a lady. Let's do it that way. Yes, ma'am.
I may be very naive. Is there any way that we can send a word? Leave our health care alone. Leave it like it is.
That word is being delivered across the nation right now. I got that word real early. When I saw the size of that bill, there was no question in my mind that you do not go change the health care of 260 million people to affect 40 million people. And when I began to see the health care bills, so the word's delivered, the words get delivered across the nation. Those that are willing to stand up and hear that word, the word's getting delivered. Y'all are doing a great job of doing it.
Are there really 40 million or is there a 15 million?
There's 40 million people, but if you'll, I'll break it down in loose categories. About 10 million, 10 to 15, who knows how many the illegal population is, are illegal. They're mainly getting their health care either from their employer or from the county hospitals. That system is in place. They're either on Medicaid or their health care is being paid out of your county taxes. There's about another 10 million that are between the ages of 18 and 30, bulletproof. My first child, I like to admit, I went to the hospital and paid the doctor out in installments and wrote a check. I thought I was invincible. I thought there was nothing that happened to me, and I was fortunate that I didn't have something happen to one of my kids. So that's a big group of them that are not. And then we have a group of people, and I think that number is probably between 10 and 15 million that have legitimate limitations of access to a healthcare system, and they are accessing the healthcare system through the emergency room or through these emergency clinics that you see on the corners. They're paying a very high price for that service. A lot of them sign mortgages they couldn't afford. A lot of them have 2 cars in the driveway they're making payments on. But for some reason or another, they are unwilling to afford the health care, or they can't afford it, or they've got a pre-existing condition that no one will put them on. So if we're going to try to address the need, we should begin, in my opinion, with that 15 million people and begin to try to provide some access that can, not as a right, but because we're all Americans, and begin to provide access to that group first. Now, that will not cost $1 trillion. And when the Democrats say that they're really seriously interested in reform, when they begin to talk about that group, the Republicans will engage with free market ideas, and we will begin to seek some solutions. If there is $500 billion of waste and fraud in Medicare, and that's a big number. That's a big number. Then there be adequate monies to fund that kind of system. I suspect that the $500 billion that is intended to be saved is going to be from a reduction in care and a reduction in payment. And that's my biggest fear, is that $500 billion is going to be taken out of the most vulnerable people in our society. Thank you for the question.
Kenny, follow on with that one right there. We know from when our first Texas legislature, part of the expense really is needed tort reform. And that's where so much of our medical bills are going for, is for the doctors to pay for the lawyers that prevent them from being sued. And there's nothing being said at all.
No, I cannot imagine, frankly, a bill ever originating in this Congress that has any element of tort reform in it. And that's sad, because it ought to be part of the equation. It won't be the end-all answer, but it ought to be part of the equation. It really worked in Texas. Hospitals began to be able to afford their insurance. They were able to take that money and put it in care. So you're absolutely right. I need a female until just ma'am.
This says that the employers will have to pay for the health care bills of employees and their families. Can you explain, is that like, how is that taxed? Is that per employee that they have, or is that just,
Well, under this plan, if you have employees above if you have a business that employs a certain number of people, or payroll amount, it doesn't really specify numbers of people, it's payroll amount. If you don't provide the health care, then you'll pay an 8% penalty. 8%, I've done 4 site visits already since I've been home to factories and stuff. And the people that own the factories say 8%, we'd pay that penalty in a minute. And then we'll just cancel our health care plan and they'll keep going on the public plan. And so a lot of people now that have health insurance will be thrown off of the rolls, because I think 8% is a pretty modest number for most people for the health care that they're being provided. So it's the size of the business. I think if it's $400,000 or less payroll, you will not have this penalty and you will not have this. So, but as it goes up, it gets very aggressive. But it doesn't get aggressive enough. If you're trying to actually force the employers to provide the health care, then the penalty would be much greater.